Hey guys, welcome back to our channel, GP Cooks. Today is a special day because we're celebrating Dysautonomia Awareness Month, which is October, and Invisible Illness Awareness Week. And this is so good because dysautonomia is an umbrella term of a bunch of different illnesses that you can have that affect your autonomic nervous system. One of them being POTS, which is what today's video is going to be about. I have POTS, which is Postural Orthostatic Tachycardia syndrome. And this means that when I stand up, my heart rate shoots up and my blood pressure shoots down. Now, POTS is defined as a lack of blood flow volume that occurs when standing up. So the postural orthostatic means that when you sit down to standing or lay down to sitting, your blood doesn't pump where it's supposed to, and your heart rate and your blood pressure do a lot of work to keep you healthy. There are many symptoms of POTS, and I even read that POTS can feel like COPD. The symptoms can be shakiness, chest pain, shortness of breath, dizziness, lightheaded, fainting, pre-syncope, tachycardia, blurred vision, and brain fog, and probably many more. You can have GI issues, all of this stuff from POTS. A normal person's heart rate and blood pressure keep blood flow at a healthy level, but people with POTS, their body doesn't work that way because your autonomic nervous system needs help. It's dysfunctioning, which is what dysautonomia is. The majority of people with POTS is women aged 15 to 50, and it's 80% of the population diagnosed with POTS is women aged 15 to 50, but boys and men can still get it. What helps POTS is salt helps a lot. So I know it sounds funny and a lot of people are like, salt, that's bad for you. But for people with POTS, salt is really good for you. You can eat as much salt as you want, take salt pills. I even inject pickle juice into my tube sometimes just for the saltiness, because when your blood pressure is low, you need the salt to bump it up, and it really helps. A lot of people with POTS wear compression stockings, which are stockings that go on your leg, and they help the blood flow and help you to not get blood clots and help you to the blood to flow so you can walk and not be as dizzy. Steroids do help POTS as well. I'm on a steroid that helps my blood pressure and my dizziness. And then another thing that you can be on is a beta blocker, which helps lower your heart rate, which they're thinking about putting me on. You can't have caffeine because caffeine makes it a lot worse. But none of these cure POTS. POTS is chronic and it's an incurable illness. So you will deal with this. Some people do grow out of it, but if you don't, you just have to take all these precautions and do the best you can with the life that you were given. Exercise helps POTS because it helps get the blood flowing and it helps get your stamina up, but it's really hard to exercise sometimes with POTS. It makes your heart stronger, and it's hard to exercise because you're so dizzy. I went to physical therapy for like months and months for POTS, so that can be a stepping stone before you're allowed to exercise at home or at the gym. A lot of doctors misdiagnose POTS with anxiety because they don't really understand your symptoms, and a lot of them cross over with anxiety, like just troubled breathing, high heart rate. All of that is anxiety, but it's really not. It's actually POTS, at least for POTS patients. So the way that it's diagnosed is a tilt table test, which is where you're on a table and you have your blood pressure cuff on you and your heart rate on your finger, and it tracks your heart rate and your blood pressure continuously as you're going up on the table and then standing, and it sees if you drop your blood pressure or if your heart rate rises. POTS is a very debilitating disease because it has fatigue, it has brain fog, it has dizziness, and weakness. It makes it really, really hard to to do everyday things. And sometimes my vision even gets blurry, so it's hard to drive. And it's hard to do stuff around the house because I'm so weak and I'm so lightheaded, or go to class because I feel like I'm going to faint. And I have fainted in class multiple times, and it's just so hard and the brain fog makes you not understand your schoolwork. So POTS is very debilitating, and you can get very dizzy and just end up spending days on the couch, and it's just awful. So I try and eat as much salt as I can, inject as much salt as I can, drink a lot of water, Gatorade, drip drop, banana bag, anything that you can do to get your electrolytes up, and anything you can do to get all the fluid in you that you can, and eating salty food. But the thing about POTS is that I get like flares. So there's something called the October slide, and that's what we're in right now, which is basically when the air levels change, the seasons change, school's starting up again, work's starting up again, and it's just like everything gets amplified because of all the outside forces that happen around September, October, November. And a lot of us POTSies do just completely go into a flare for these months. But being in the heat is hard too in the summer, because being really hot makes me nauseous and it makes me dizzy. But I try my best to just live like the life I was given, and it's really hard to deal with, but it's really it's an experience, and it makes me stronger, I think. Definitely. Yeah, so POTS, Postural Orthostatic Tachycardia Syndrome, affects me, and it affects a lot of people around the world. It's actually more common than you would think. It's not a rare disease anymore, it's a common disease. And dysautonomia does affect millions of people around the world. So thank you for tuning in and learning a little bit about dysautonomia and invisible illnesses. Thank you for watching. Don't forget to like and subscribe.